Hi everyone! Starting it off right away, getting our brains warmed up with some music to learn more about the COVID disease that is spreading around our world right now. Again, this is Whitney Morgan, uh, interim program coordinator for the EMS program at Northwest College. Thanks for coming in, and I hope that I enlighten you at least somewhat and some more reliable information while you're here. Especially welcome to our students who are on an extended spring break. I hope that your brains get turned on a little by this and you seek out more information that is reliable, that is not found on Facebook Medical, and then begin to, again, spread that information out into the public so that people can be equipped with good knowledge. Okay, so let's talk about what COVID and what these terms are that we actually should be using. So the virus in and of itself is not called COVID. It's actually called, oh, it'll let me type, SARS-CoV-2. So that is the name of the actual virus. And maybe we should put virus right here so we can follow along. The disease in and of itself is called, oh, not void. I wish it were void. COVID-19. So this is the coronavirus disease that is causing symptoms, but the actual virus in and of itself is called SARS-CoV-2. Now, if you look at this, you recognize SARS from previous crises that we've had or pandemics that we have had. But what does that actually mean? So you may not remember what SARS stands for, and that stands for severe, oh, it's still not letting me type. Severe acute respiratory syndrome. So, what does this virus cause? Well, even if we look at what the virus is called, SARS-CoV-2, it means severe acute respiratory syndrome. So we know that this virus is going to cause respiratory distress, among other things. So we know, we'll go over different types of symptoms later, but we know that the source of the problem with this is that SARS disease. Coronavirus in and of itself just means that it is derived from another animal, and it can be shared between two animals, we ourselves being animals. So coronavirus equals shared between species. In this case, we already talked a little bit about the fact that this particular, the SARS-CoV-2, or properly known as COVID-19, could be shared from us or to us from bats, but we don't know that for sure yet. We just know that they have a high incidence of similarity between them. So these are the actual terms when we're hearing people talk, what they actually mean. Again, COVID-19 has become kind of a label, but that is the actual disease caused from the virus rather than the virus itself. So, we talked a little bit before about what the virus is made of, how does it infect people, but what is nice to look at is, how widespread is this? Because people have been significantly downplaying it, getting misinformation about how prevalent it is across the world. So there is an interactive map done by Johns Hopkins, probably by their awesome bioinformaticians. I hear that they're a cool group. Anyway, they created this awesome map. And what you can see here is, here was where we know it came out in December 2019, just a few short months ago, really in the timeline of a virus, very short time period. It kind of erupted out of here, and now we've got this just massive spreading throughout the entire world. You can access this at this website right there, so you can go on anytime that you want and look at it. These are the total number of confirmed cases in the world. So it's important here to look at this to acknowledge confirmed, and that means that these people have actually been tested and are known to have had it. Is this number higher? Definitely, because we are not testing every single person that shows up with the COVID-19 symptoms. It's just not possible to do that. So it is possible that you yourself may have had it and transmitted it. Some people are asymptomatic, and they can transmit this when they're not even sick themselves. So it is possible that it's more widespread through the world's population than we realize and scientists accept that this number is probably quite a bit higher. But of those confirmed, this is what this map is reporting. So we know 174,995 total confirmed, and there have been 6,706 total known deaths caused by COVID-19. So those are, again, only numbers that we can report on for sure. So it's possible that these numbers will become much higher if every single person in the world were tested, which is not feasible. This is about a 3.8% fatality rate currently. Again, this number is probably going to go up. That percentage is probably going to go up because it's still spreading throughout the world. We obviously don't have widespread, everyone's been exposed infection yet. The total amount recovered, that's a promising number, 77,000. So people are recovering from this, but still a 4% death rate is pretty significant. And we can see here in China where it started to begin to infect, and then they began to put strong requirements on their population as to social distancing and staying within their homes, and now they have this nice leveling out. However, in other locations, we're getting this sharp increase infection rate, and as we'll go over later, this is going to just keep going up and up and up unless something happens where we again level it out. So where they have this sharp increase, China made an intervention and now they leveled out. We're at the sharp increase, and really it's going to be up to the world's population to affect this. This was last updated at 15 minutes ago, so pretty accurate information as to what's going on as of the timing of this current podcast. But you can always go on here and take a look for yourself, play with the map. If you're into logarithms, you can see how that data might change a little bit. Even logarithmically, we can see China leveled out here, and we still have this growth rate of other locations coming up. And we want to see this total recovery continue to go up. We don't want that to level off either, so we'll see how that goes. It gives you a total amount of new confirmed cases. You can see that we kind of had a slowing down here, and now all of a sudden we're having these spikes. And as the virus continues to spread, this is going to continue to show those reds there. Let's see if I can get back to my other screen. Okay, so we know that it's going throughout the whole U.S. We know now how to define what the virus is called, what the disease that causes, or the virus causes is called. We know coronavirus just simply means shared between species. I know there was a graphic going around with a Lysol can and combating coronavirus you already set up. Well, that just means that, yes, there have been previous coronaviruses, and we saw that family graph in the other presentation of how those are all related genetically. But this is a new one, or what's called novel. So this is one we haven't seen anymore, or before, sorry. Let's talk a little bit about another definition to kind of give greater understanding of what this means. What is pandemic? So pandemic just means that there is a virus or a disease going around the entire world right now that none of us have an immunity to. And that's not surprising because, again, we talked about this word novel. So this is a brand new virus, meaning that none of us have ever been exposed to it before. Therefore, none of us have been able to develop an immunity. And whether you develop an immunity yourself, which is naturally grown within your body, or you acquire it through a vaccine, neither of those options are available to us right now. So pandemic really means that this is going through our world's population, and none of us are able to say we're immune to it currently. So that does cause some concern. Again, there is concern that because none of us are immune, that we could get it, and we could be carriers of it without giving symptoms. So you might feel great and think that you've survived this coronavirus pandemic or crisis time, but reality is you could have been a carrier of it to several other people who may not have fared as well. So that's where it becomes important to do the social distancing, to follow those guidelines even though they're inconvenient. Because while you yourself may be well, you may be causing further proliferation of the virus and inevitably deaths of people just by not adhering to those guidelines. Now finally, a little levity. My brother, his name is Justin Berg, totally gave me permission to use his name and use his doctor's stamp on this. He is about to graduate from medical school, and I texted him one day and said, they think that this is related to that coronavirus. And he said, yeah, he is going to school in Nebraska medicine, kind of the hot spot in our country of studying the virus and treating patients. And I said, what do you think about declaring people who survived this Batman or Batgirl or Bat person, however you identify? So I'm gonna kind of take ownership of that and give you permission. Let me turn on your theme song here. I'm giving you permission, if you survive this, to declare yourself a Bat person, and you survived the COVID-19. So congratulations on becoming a superhero, and I hope that you will become a further superhero by helping us in our endeavors not to spread it, because not everyone wants to be a Bat person, but certain few people do become superheroes of this way. Again, Justin totally gave me permission to use his name here. He's going to be super excited when he watches this. All right, well, I hope you'll keep joining me. We'll keep doing some educating and learning while you watch this from home in the safety of your recliner while drinking a pop and enjoying this presentation. Okay, so we see you next time. Bye-bye.